As a caretaker, I turned to her and I said, "How are you doing? Do you mind if I hold your hand?" That was the invitation. All her concerns were coming. She doesn't know whether she was doing the right thing for him. That was my space now to say, I want you to trust us, to believe that we're going to provide a safe space for him.
Levindale's Brain Health Unit is completely different than any other facility in the area. We are a geriatric med-psych ward. We treat a full spectrum of psychiatric illnesses. The majority of our patients have neurocognitive disorders like Alzheimer's or vascular dementia, Parkinson's. We also treat depression, schizophrenia, bipolar disorder, anxiety disorders.
It's looking at the patient holistically. We have patients, their main problem is hypertension, it's diabetes. So we have to make sure those are taken care of before we can treat the psychological.
Successful interdisciplinary collaboration looks like during the treatment program, each allied specialty is involved in the patient's care.
Recreational therapy is a part of the interdisciplinary team. A typical patient that we see here at Levindale is someone who may have been struggling in the community and has come to us because they need a little extra help, whether that be physically or emotionally. We see patients in collaboration with the providers, with therapy, nutrition. It's not about just the diagnosis, it's about the entire person. A lot of times when we're in a health crisis, we're out of control of our choices. So putting an art activity in front of one of our patients allows them to have that expression of creativity and choice as well.
We have a very robust social work team that assists the families with disposition. Somebody who's living at home who can't live at home anymore. So their disposition would be to then go to a different level of care, for example, assisted living facility or a long-term care facility.
So this one space right here, you can have several activities going on.
The sensory room is really important in the treatment of mental health, especially in the patients that are cognitively impaired.
There's an area where we're able to put on soft music. On the walls, they can touch things. Right now, we have a patient on one of the other units. She goes to sleep with this baby. She wakes up, she takes care of her. Rather than giving a PRN medication for agitation, we can be able to take that patient to the sensory room and just work with them one-to-one.
People come to us from home, from assisted living facilities, from long-term care facilities. And our goal is to try to improve their level of care, or at least get them back to where they were before they required hospitalization.
If a family is touring the brain health unit for the first time, I want them to feel compassion. As I say to my team, you give that patient the things you would want, the things you want for your mother, your father, your family. I want them to leave with a sense of, my family will be safe here.